Well, the report was delayed due to disputes with the Indian government. The death rates on the continent are believed to be significantly higher than authorities have previously admitted. From Delhi, my colleague Devina Gupta joins me now. And Devina, the Indian government really pushing back on this report, and really it differs from the official numbers they've given.
Yes, Yalda, there has been a statement in the run-up to the release of this report by the Ministry of Health here, which has maintained that it's difficult for an international organization to accurately depict the picture of the number of COVID deaths because of the kind of geographical challenges and the record-keeping challenges. It has said also in the same length that there have been multiple consultations with the World Health Organization officials and between the government officials. There have been discussions so that they can present the correct methodology. The statement says, though they do not want to dispute the result, they do dispute the methodology used in calculating these numbers, which are clearly 10 times more than the official estimates here. The government maintains that COVID deaths were less than a million. So there were about 500,000, according to the Ministry of Health officials, up till May 3rd this year. There hasn't been an official sort of counting done by any agency here, apart from these figures released by the Ministry of Health, where the methodology still, interestingly, is not clear of how they arrived at even 500,000 figure.
Yeah, and that's the point, right, Devina? They're criticising the WHO for the methodology, but the Indian government itself hasn't revealed how they've come to their numbers. And the WHO says that the estimated deaths in India could be as high as 4 million.
Absolutely, and that's what the tragedy is, Yalda, because I remember reporting on the ground and speaking to people who were also quoted in the story of those people who are at the burial site, the non-government organization officials who are working to help give a dignified burial to those families who had lost their loved ones. And they clearly said that there was no record keeping of these people who had lost their lives, people who were dying in the hospitals as well. There was such a chaos at that time. It was difficult for even official record keepers to go and see what was the actual cause of death. And that's why it is crucial that the government comes at least with some clear stand on how they've arrived at their numbers, and also help in preparing for the future of such kind of emergency that may arise from coronavirus if there is a continued wave here.
Okay, Devina, thank you so much for